Hello everyone, this is CatchLife calling. So today we'll be talking about a great misconception that we have. We generally believe that females having plastic surgery more often, but we also have male patients too. So today with our guest, Dr. Murat Düzener, we'll be talking about the men aesthetics. Our topic is, so we will be prepared questions to be answered by him. They are mostly and frequently asked by our the patients. So if you have any questions in the meantime, please send it below so that we can just answer all of them while our surgeon here. So first of all, how are you?
Thank you.
How is everything?
Everything's okay. And how are you?
I'm good too, thank you. So I will start with the first question we have, which is about gynecomastia surgery. So who is the ideal candidate for gynecomastia surgery, and how can one distinguish between fat-related fullness, chest fullness, and also true gland enlargement? We also say like breast tissue.
It's a good question. The gynecomastia, I want to first say something about gynecomastia. Gynecomastia is a disorder. We can know when the puberty finished at 80 and 90 years old. Its termination as gynecomastia means this, the female type breast on a male. After the puberty, when a male have a female type breast, we say that gynecomastia. Gynecomastia contains breast tissues, the gland tissues. When the gland tissues complete, because when we examine the person, we say there's a gynecomastia view, but the exact test is taking off and making a pathologic check. Then we can say that it's exactly a gynecomastia or not.
I understand.
Because of that, before the operation, sometimes we do an ultrasonic imaging. Then ultrasonic image also says it contains the fat or the breast tissues. What it means, it's important because in the early age, sometimes if it contains only fat, we suggest the patient for waiting a few extra years for maybe doing exercises or diets. Sometimes that fatty breast get better by the time. But it contains, if it contains the breast tissues, we directly suggest the treatment.
I understand. So we have ultrasonic image before the surgery to decide.
An examination. During the examination, we palpate the breast, and if it's contain breast tissue, because the breast tissue is hard than the fat tissues, but the ultrasonic check will help us.
So if the patient has the breast tissue, is it to be removed with an incision? So
it's all about the powerful of the liposuction device. Some liposuction devices are very powerful and can take off
the tissue
too. And there are many techniques, but as a result, the patient don't want come again for the operation. Because of that, I usually suggest a small incision and seeing the tissues and examining tissues. I exactly suggest it. I always combine with the liposuction for supporting the contour where I excise the tissues.
Then the next question is more about the muscle implants, which is very close to the area that we're talking again. Muscle implants are designed to enhance shape, of course. How do you ensure the results look natural and not overdone? And can we talk about muscle implants first of all?
The muscle implants is the large range. There are many kind of, and all is adjustable ones. We always cut and adjust according to body's proportions, body's anatomical specifications. We always use, and we prepare the implant according to patient. There are many implants, and usually we are talking about male aesthetics, the pectoral implants, deltoid implants, and calf implants. Also, we use the calf implants on females, but also males usually wants calf implants. We use the implants over the muscles. Sometimes under the muscles first layer we say fascia. As a facial we say that. We decide what the patient wants, how look they desire. Then we can draw firstly. If we can do, we make an illustration about it, and we talk about it. Then we decide the shape together. Then during the operation, we do what we talked. We put inside. But, usually we use pectoral implants, deltoid implants for a more masculine appearance.
I see. So pectorals for the chest area, deltoids for the shoulder.
For the shoulders area, the anterior, the front shoulders especially on this area, not the back one. But I said it's adjustable. Whenever area you want, we can examine it because our implants are suitable on every body parts.
I see. So would you advise the patient to be fit for these type of surgeries?
Exactly. If we want a muscle effect, it's important making your muscle visible.
I see.
Because of that, the diet and exercise for the other muscles is very important.
So it helps with the definition.
Yeah.
At the very end, I understand. So another question is about being fit, or you can have liposuction for six-pack.
Oh.
So can six-pack liposuction really create long-term definition, or does it depend heavily on lifestyle after the surgery?
If the patient change or go on the hard lifestyle, yes. It's not only about the surgery. We can obtain during the operation. There are two terminations about six-pack. One is real definition, the other is high definition. High definition means we mimics with the fat grafts, the packs.
I see.
But on the real definition, we suggest the patient making a muscle as much as they can do. Then we make that muscle visible.
I understand.
This is more real and more long-lasting.
So,
and after the operation, the diet very important. Sometimes we suggest only one-time diet in 24 hours.
That's great, because like I have also friends who go to gym but couldn't have six-pack, or in your terminology, you said that some stubborn fat is there, and it's not visible for that reason.
Exactly.
And if you remove these fat deposits from specifically the six-pack area, it can show itself.
Exactly.
Or the second method is that you mimic the six-packs and then you show them as if they have the muscle look.
We don't suggest that, but if the patient wants that appearance, and I can't do any muscle exercise, then we can do that.
I understand. It's a great
But
question.
the six-pack liposuction is very different from the traditional ones. With the traditional one, we try to take off the deep layer fat. But on the six-pack, we have to also get off the superficial fat layer. It's attached to the skin. It's very hard. We use specific devices like ultrasonic liposuction, laser liposuction. We do that. And before the operation, we draw the areas. Some areas we do aggressive liposuction up to skin. And some areas we leave a little for the definition. It's totally a specific technique.
I understand. It's more like reconstructing the area. Totally.
Exactly.
So yes, and the other question is about the face. What role do a facial bone structure and skin thickness play when reshaping masculine facial features? And we see lots of fillers.
And sometimes it's advantage. Thick skin, sometimes disadvantage. It's all about the aim, what we want to do, what appearance we want. For the especially on the jaw lines of the corner of the jaw, we usually use hard fillers like hydroxyapatite, not uric acid ones, because the hydroxyapatite fillers gets more strong
More dense.
and long, more dense and long lasting. And the golden key for the reshaping the face are the implants. We usually use implants. There are many kind of silicone implants and other porous implants like a stones, and we can use it. And also it's adjustable. With new technology, almost all implants, adjustable ones, we can change it during the operation. We can cut it like a wood.
I understand. You adjust the implant in accordance with the patient's anatomy.
Exactly. We put first, if we don't like the appearance, we put it again and we reshape it and we put. It's very good for the new technologies.
It's great actually you're specifying the implants for the case itself.
Exactly.
And also, out of curiosity, do we have any cheekbone implants?
Yeah.
We do have for this. Interesting.
There are many techniques for it. The lower eyelids techniques, not very.
For the incision, you mean?
Yeah, because of the incision on the lower lid, superciliar incision, we can apply it. But sometimes we apply it from inside our mouth. We can put it
to make it more invisible.
Yeah.
I see, because as far as I know, chin implants is also done from the inside of the lip, and also you use, I'm underlining that part, a different type of fillers for the jawline, because hyaluronic acid actually is more fluid.
Exactly.
And it should be more like dominant there to define the jaw area.
Exactly. We want more hard tissue on that area.
So not every filler type is suitable for jawline, and I understand for the structure of the face. Yeah. And one of the most common questions, and we had many patients for this procedures too, when it comes to men aesthetic, of course, penis enlargement and also girth enhancement, which is for the thickness, are surrounded by myths, it says, as the question. What are the realistic outcomes patients should expect?
It's very specific issues, because we can't know what's the result really, because it's a functional body part. Yeah. After that, we have to ask this: what about your function? But we can say it's only about the thickness or the shape of the penis. It's a very complex issues. Because of that, we can't know they reach their aim or not. We have to evaluate like this. This is this centimeter. After that, we will get this centimeter. We can say only this. We can say that now it will be better for you. You will get a better sexual life. We can say it.
Of course, because you cannot guarantee that.
We can of that. This question is very interesting. Yeah. Because of that, we can't know. Sometimes we ask the patient. They say yes, everything is okay, but it's not mentally. It's not. I don't think that it's real, because the sexual activity is very complex. It's not only about the thickness of the penis or like that.
Like, since I'm a coordinator, which I receive lots of inquiries regarding to that, but they come with unrealistic inquiries, but at the end, when you as surgeon inform them, they're just nowhere to stop, because for example, if you go for fat transfer for the girth enhancement, and if you do it a lot, it can cause sexual dysfunction too.
Exactly.
And so there has to be always a limit.
I mean that.
And so the patient.
I think loss of affect is psychological.
Definitely.
Because the lookage is the affect is maybe most important function, because the function not directly about size. Because of that, the appearance is okay. For appearance, if it's really small, we exactly suggest it. Firstly, for appearance. Then the other things is plus only. We can't say this is not totally functional recovering operation.
So we can say that the patient has to come here with a realistic expectations.
Exactly. It's not mean that as much as we get bigger, it will be better and better.
Yes,
we
definitely.
can compare with that.
I agree. So another question, Can different male aesthetic surgeries, such as gynecomastia correction and abdominal sculpting, or maybe we can say that in the same context, like tummy tuck maybe, be safely combined in a single operation?
Yes.
So easy.
We can combine.
You can get them
in the aesthetic
all.
surgery. In the aesthetic surgery, we usually do this because we have an aesthetic units.
Yeah.
For example, for the face, there is no and only aesthetic units for the nose.
Yeah.
We have to check surrounding tissues like lips, eyelids, cheeks. If that areas also need some things, we always suggest it. Because after the operation, patient looks on the nose for a few days only. Then after mouth, they start to look at the face. It's suitable for.
I understand.
Because of that, it's same for the gynecomastia. When we during the gynecomastia, we also examine the tummy. If they need, we suggest, and we usually combine it.
I understand. So what I'm going to say is that when some part of your body that you focused a lot is corrected, then you started focusing on the parts that you don't like more and more. It's something contagious.
We usually see this when a woman have a big breast. And they can't see the tummy directly from this position. After the reduction, they start to saw the tummy. Then they say, "Wow, what's that?" It
is the same with men, I guess, because imagine a patient who has pectoral implants but a big tummy. Then all of a sudden you go for high nav and tummy.
People's very interesting people. They only take photos on the upper part, maybe.
I understand. I agree. So
everybody's aim is different.
We can safely combine all of these surgeries in single operation. If your test results are suitable for having them as combination, this is one of the biggest thing.
First your health.
We prioritize the preoperative tests a lot, and if you see any levels are wrong, he may cancel your surgery or delay your surgery for another date. Another question: are the scars for male aesthetic procedures usually noticeable, and how do you minimize their visibility?
The scar, the final scar, not directly about our operation techniques or aftercare situation. It's primary about the person's genetic.
Skin type.
The reaction of the body to the trauma. We try to make it more slowly. If it's tend to be hypertrophy, we have some treatment. But usually, if the genetically it's not tend to be hypertrophy, the scars will be almost invisible on all areas. But the other factors we can change. We can control the other factors affect scar. What's that? The suturing techniques. And not getting infection on wound. Aftercare instructions,
protecting yourself from sunlight.
We all do this, but if the genetics is tend to be, it will hypertrophy. When we aware of the hypertrophy, we have some treatment about it.
Like can we?
But if they tend to be keloids, we can stop it. We can stop it.
Like sometimes they use steroids to.
No, we can stop it.
I understand.
Hypertrophy, yes. The hypertrophy is not disorder, but the keloid is a disorder. A genetic disorder.
So what about diabetes type 2 and healing problems?
Exactly. And also we have treatment of keloids, but it's different. It's not making a zero or invisible scar on keloids. On the keloids, our aim making not mass appearance.
I understand.
We have to get off the mass, not the total appearance.
So it's about the skin type and genetics, most likely.
But we will control all other factors. As a technique, we atraumatic, non-traumatic suturing, not very hard suturing. We do that. We do wound antiseptic, antibiotics, aftercares, wound cares. We do all, and it's all about the others, about your genetic issues.
Definitely. So the last question is that what should patient avoid after surgery to maintain both functional safety and aesthetic results?
We always talk about it. It's post-operative instructions. We always give as a text, and we talk all about. It's important starting the normal daily life when the wounds heal totally, and aware of some problems before they goes worst. Aware of the infection. We talk all about that, but it's primary about the operation. If the operation, after the operation, there is risky things we always talk about. For example, if I don't suggest swimming in the pool.
Yeah, of course.
This is very important.
It's written in the post-op care. You cannot.
It's very important. Yeah. It's very important.
Full of bacteria and
Like
keeping the area dry. We always say that. Even showers.
Keeping the area dry.
Yeah.
Examining your own. It's
Yeah.
very important because there are simple things aware of some problems.
Of course, like even with a cut, people do not suggest you
And
to
keeping
go to
the
a
communication with us is very important.
Yeah. Weekly updates.
Yeah, exactly.
Also, like for the wound care, we advise.
And other things similar with every kind of operations, diets, healthy lifestyle, these are important. Yes.
Of course. So yes, for the specifically post-operative side, we want you to be in contact with us, so that even with a single, if you think that it's a very dumb question, please ask it so that we can ask him.
Exactly.
And then he can just reply you back. And we even do sometimes video calls with the patients who had their surgery already in accordance with his availability, since he's not an available person all day, but we just arrange certain times to work together. That's it. But if you have any extra questions, please, you can comment down, or you can directly send a message from our DM, and then we can just answer all of them. I think that's it today.
Yeah.
Thank you very much
Thank you.
for your time.
Thank you.
And stay healthy.
Bye.